Guys, this is Dr. Katinka and we're at the Neurological Relief Center in Fayetteville, Arkansas, working with Elizabeth from Sweden. And we constantly have videos of testimonials, and I want to do something different today and give you guys an inside peek at the actual treatment. So today we're going to work with your allodynia. And I'm going to show you guys part of this treatment, but not the whole treatment because it's licensed, so it doesn't belong to me. And we are going to desensitize your nervous system. Now, before I get started, few things. I'm not a big fan of desensitization therapy because what that is, basically you're using the brush and you're exposing the patient over and over to a stimulus saying, get used to it. But to me, that's the same as punching someone in their face 200 times and saying, get used to that. So to me, that's barbaric. This is more sophisticated. We're going to show the brain that it's responding abnormally to sensory input like light touch. How long have you had CRPS for, Elizabeth?
Must be 3 years now.
Okay. And the allodynia is the last thing left, right?
Yeah.
That we're working on. How are you doing overall?
Overall, with the treatment, it's very successful for me. I've gained so much strength and I gained 20 pounds since I got here, so that's just amazing.
Yes.
You helped me so much with that, and I can feel that with all the different sort of treatments you have this very good package that you so carefully need when you're here, because you think that it's just one thing, but it's so many other things that you have to have at the same time, so it's a puzzle. And it's just amazing how this is working for me as well since we started with this.
How's your allodynia doing?
When I arrived, it was pretty often like a 9 out of 10, and I could not even wear socks or something like that. And also with temperature changes, it was extreme for me. I had those very white hands where I was just red and boiling, and since it's like being a lizard, I can't, go from warm to cold because I just had to do this all the time. But then when we started with this treatment for like 1.5 weeks ago, it's so much better. It's so much better, and this is just amazing to experience and to achieve this.
Elizabeth thought that her problem was cold, but what I have determined, it's not really cold, it's her nervous system's inability to have changes. So if you just stayed cold, that would be okay, but once you warm up and it has to change, it couldn't handle that adjustment.
Yeah.
So that's what we're working on. We're going to start with cold and expose you. And again, I can't show the whole treatment, but just to kind of show you guys what you can tolerate. We can also do light touch, because that's your biggest enemy, right?
Yeah, light
feathery touch. All right, so we'll only show the upper body today. I will treat upper and lower body. Okay, so may I have this hand? Thank you. Okay, and I'm going to use a very sophisticated tool, my hand. And just light touch. Is that causing pain?
Yeah.
How high are you out of 10?
5, 6.
Am I touching lightly enough?
Yeah.
We need a feather. It's much better than yesterday, yeah?
Yeah, much better.
Yeah, the part you guys can't see is what I'm doing with my other hand. Alright, let's move to cold. We're going to start with ice. What would happen back home if you were touched with ice?
Extreme pain, and then I would just be white. And also that I can't even go swimming in the water during summer, because when I did, I had to wear maybe 5 jackets afterwards and a blanket, and I had something on my head and gloves, and it was still warm like in the summertime, and I was like this for maybe 3-4 hours afterwards. So when I took a bath, my parents had to come and pick me up so I can just go home and into a very warm shower.
How high is your pain out of 10 right now?
Now it's maybe 5 or something with allodynia, otherwise no specific pain.
So we cannot do this work in the first, my gosh, probably 5 weeks of care, because it would send your pain through the roof, but you're much stronger now, you can tolerate it. We've done a lot of rehabilitation. So we'll start here. Is that okay?
Yeah.
That's extra cold today.
Yeah.
No weaknesses yet. How's that?
Almost feels good.
Are you spiking higher than a 5?
No, it's not 5 at all. It's just, it feels better now. It's just, as you sometimes want to just be cold, like a sensation. That the body is, wow, yeah.
So you just got a cup with ice, kind of improvised. Okay, grab the glass and hold it. That was the first little bit of reaction we got from your nervous system. All right, fantastic. All right, now the real test comes now. We're gonna warm it up. So your nervous system has to change. This is warm water. And you're handling that like a chef. What's happening with your pain?
It doesn't feel so much pain anymore. It's just that I feel that I'm a little bit warmer.
Your hands are not turning white?
No.
How quickly would that change normally come in skin color?
20 seconds maybe, something like that.
Can you zoom in on her hands, Cam? No color change. You look much more tan in real life than on the camera. I just saw that shot. Big change there. Grab the glass. Very good. Let's grab the glass on this side. Holding. That's upper body. Where's your pain? 10, 0. Yay! So that's a much more gentle way of treating allodynia. Thank you for watching, guys.